public health specialist. I happen to manage a patient who is suffering from HIV, affected seriously, and another lady, a student, 300 level, who was involved in a fatal accident and involved a spinal cord injury operation. Let me start with the HIV patient. The HIV patient is also a veterinary doctor by profession, and he was living in Benin. I happened to be a close friend to the family. We brought him down from Benin unconsciously because of the infection of the HIV. The wife had to leave him when she discovered about the illness. And right and behold, we took the patient to one of the hospitals in Nigeria called Federal Medical Center in Nasarawa State. He was diagnosed. From the reports given from the results, they detected he has TB, that's tuberculosis. He was also affected with pneumonia. And by and large, he has he has malaria at that time. So they admitted him. We were trying to manage his case, and they discovered that the whole situation is not helping him. They have to do a referral to the national hospital, that's just like the highest institution for treatment. But the brother was surprised because he had never had anything about this illness happening to him. They were thinking it is only malaria and this thing. Having known that it was HIV, he lived with it for 11 good years without taking any anti-retroviral drugs. So once we discovered that he was HIV positive, and that was when we were in Destina1. So the product was introduced to us, and I said, I want to have a trial case on this patient. And I contacted the relative because they were afraid that there's no treatment for HIV cases. They said, Kai, okay, let us make an attempt. I told you we were trying to take him to National Hospital in case of referral. So they brought him home first so that they can source for money, because National Hospital is very expensive. So we placed him on the product. Within the first 2 weeks, sorry, I forgot something, he was coughing furiously. And that thing made us, he had emaciated, he had lost weight completely. So when he started taking the products, after some time, the coughing stopped completely. He started regaining himself. In 3 weeks, all of us are shocked. He has regained his weight, he has regained his size. He started communicating normally. And the brother was shocked. He said, what happened? This product is seriously working. And he said, but we told him to continue with his anti-retroviral drug that they gave him from the hospital. So he was on it, taking the product alongside. After a month, we discovered that he has become stable. And we said, let us take him back to the hospital. We took him back to the Federal Medical Center, Kefi. The doctor who signed the referral, when he saw the patient, he could not believe that it was the patient. We went and did a test. They discovered that the TB is completely gone. That's the first result that we had. And we did a PCR and discovered that there's still element of the virus for the HIV. So we were advised to continue on the treatment. We did not visit the National Hospital, so he was home. After 2 months, we did the test where he stayed. It was negative. Wow. So we went back to the same place and did a PCR test and confirmed him negative. Wow. As I speak, he's negative to today.
Wow!
and he's doing very, very well. His wife, in fact, he has opened a very big poultry farm in Benin, doing his business. And the wife and the family has come back. Now they are having a stable family and everybody is doing very, very well. What I don't know is the wife. I have not tested the wife whether she's, because you know, when he detected his negative, the wife ran, positive, the wife ran away. But seriously, Destina1 product was wonderful. He took the pendant, he took the sclavia and the flax. And that was what was living on. And this product is wonderful. When I heard about this testimony, then I went to Mina in Niger State. It was in Niger State we met Fatima Abdullahi. She's even coming to give her testimony anytime. Because when she had the accident, the parents spent over 11 million on the patient. Yes. Completely, she has what is called a committed fracture. The whole legs were totally bastardized. She had a Doppler because the doctor who did the surgery stated in her report she can't walk again. She can't walk again, talk less of her standing. She was helpless. When we met her, you see a lot of wound because at the buttock she developed pressure sore. The whole thing had eaten the whole of her buttocks. Her skin completely, oh my God, you need to see her. And when I came, I told the family, we have a product. We're just going to test because I've never used it somewhere on such a case. And the mother welcomed me. She's the head of department in a particular teaching in the general hospital in Niger State. She took the product, her own was miraculous. The way the product worked, the whole skin were completely restored. All the, oh my God, the gangrene, the pressure sore were completely healed. Her skin changed. The mother started shouting, please come, I need more of this product, I need more of this product. And when we came, we gave her the product. I want to bet you, after 2 months, we took her, because they did the surgery in Nizamia Hospital in Abuja, and they are living in Niger State. We took her to the hospital. The doctor who did the surgery saw her walking. He jumped up and said, what product did we use? And he was surprised to tell his Destina1. He even signed up to join us in this business. And that was the time we later had this problem and we started having problem in Destina1. But I want to assure you that the same lady now, she's back to school, reading her course in the university. She has stayed home for 7 years with this problem, where she developed the case. But after the treatment, God has made it possible to her. And I want to strongly thank Destina1 for bringing this product in Nigeria. The family are willing to give their testimony anytime they come to Nigeria. So thank you very much.
So, Brother Hory?
Yes.
What products did she use?
In fact, she used the Hemedian cream.
Revision cream.
Yes. She used, that's the cream we normally apply on the legs, on the skin and every part of the body. She also takes her sclavia completely. And she have never gone to any hospital for rehabilitation or for physiotherapy, for any other thing. She was dependent only on that particular product.
Only these 2 products?
Only, no, and the pendant. The pendant. No, she used 4 products. She used the pendant,
water.
She used the sclavia, she used the water flax, and the Hemedian cream. Those are the 4 things
the
she
full
used.
package.
The full package. And we did not even double the pendant. It was only 1 pendant we have been using.
Yeah, I believe in that.
Yes.
That happens to me.
Yes.
Just one time I forgot. I feel like I'm 99 years. Only one time. No, seriously.
Only one time.
Only one time I missed the
And she's ready anytime we come back to Nigeria, possibly if the family is ready to give their testimony. And you'll be surprised to hear her telling you more about Destina1 product.
Thank you,
Dr.
Thank you, Dr. Hory.
Yes.